Welcome back, folks, to SpaceCoastMedicine.com television. I'm here with the President and CEO of Health First, Mike Means. And
Hi, Giles.
Nice to see you again, Mike. This is a momentous occasion here, and as you roll up into Viera along Wickham Road and see the magnificent oak tree there in the middle of the roundabout, it's quite a feeling. Can you express to us your feelings as we're just 30 days away now from the big opening?
Well, we're obviously very proud of this project, and we think it's going to be here for a long, long time to serve this Viera and Suntree and Baytree communities. It's an outstanding project. It's going to create a lot of new job opportunities for healthcare professionals in this part of our county, and we're excited.
I know that I guess 10 years ago, when the planning originally started, the population growth has been incredible, and you're really meeting an essential need here in the central part of the county. And can you tell us a little bit about the results from your standpoint today, looking back from 10 years ago?
Sure. Well, it's been a long journey. And this is one of the most rapidly growing communities, certainly in Brevard County and really up and down the east coast of Florida. The need is very real. As you've driven out here, you've seen not just the growth, but the expansion of the traffic, particularly during rush hours. And so having a healthcare facility that's immediately available and ready for the people who live out here is a real advantage.
Mm-hmm. And as this year, I'm proud to say I'm chairman of the Tourism Development Council, and I tell you, the hospital is a really good plus for tourism too. We have so many tourists coming to our area, and from the TDC standpoint, the Viera Hospital is going to be a real jewel as far as drawing additional tourists. So we want to thank you on behalf of the TDC, and we're looking forward to some great days ahead.
Well, the tourists and the winter visitors are obviously a very important part of our community as well. And we've served them for the length of our tenure in Brevard County, and we're looking forward to serving all those that are looking to move here.
Well, Mike, thank you so much on behalf of Brevard County for all your hard work in putting this project together, and congratulations.
It's my pleasure, Giles.
Thank you. Welcome back, folks, to Space Coast Medicine magazine. And we're here with the Chief Operating Officer of Health First. We're very proud to be here with you today, Larry, on this momentous occasion.
Glad to be here.
Tell us your feelings now as we get close to the big opening.
You know, all of us are very proud, but certainly I think the concept out here with the Viera Health Park, I mean, it's not just about being an acute care hospital. Certainly this community needed that. But as you know, we have Pro Health and Fitness that was built a couple of years ago that tries to keep people healthy and happy and not in a hospital. And also the medical office building. Having physicians here in the community practicing in here with a diagnostic imaging facility. Just the whole health park concept is the first time we got to execute that for Health First.
Well, I was just speaking with Chris Kennedy up there, and he so rightly says at the end of the day it's down to the people.
Right.
And yourself and Mike Means, of course, and Chris have had an incredible leadership team. Can you tell us something about the people who'll be leading the hospital here as we go forward?
Sure. Chris Kennedy came out here probably a couple of years ago. Chris has been with Health First for 25, 26 years. I think he has surrounded himself with some leaders internally that know our organization, know what the culture is, know what's expected of accountability. So I think they're going to have a take off right at the beginning, and it's going to work out well. So we're pleased that we gave the opportunity to a lot of our staff the opportunity to come out and work in Viera and be a part of some new hospital.
Right.
You know.
And Tom Palermo, our publisher of the magazine, was just so impressed with the facility, walking around. All the finer points, all the details have been hit so well by Chris and the team. Can you tell us some things about the hospital here that might be different from some other hospitals in the past?
Well, we've learned a lot of lessons. I mean, you know that we expanded the Heart Center at Holmes Regional. Chris led that project. And then we went to Palm Bay Hospital and able to learn some things a little bit differently, primarily for the patient and for the families. And so they've been able to incorporate here sort of the Disney concept, where you have the staff and the inpatients on one side, but the outpatients and families are on the other side, the corridor. So they're not crisscrossing, and I think that concept is going to work very well here.
Well, I know we have 250,000 square feet of healthcare here with 100 beds, and I think 84 private rooms. So people
all private rooms. When you check in at the Holiday Inn, They don't say, Giles Malone, you're going to be sharing a room with Larry Garrison. So I think the expectations of particularly, Giles, our generation and generations to come are to have their own privacy. So that's going to be a real plus. And you don't have to transfer patients from one area to another. They can stay, the complete stay, in one room.
Well, many congratulations.
Okay.
I know it's been a long time planning.
It sure has.
And a tremendous amount of hard work on your part and Mike and Chris Kennedy. We want to thank you on behalf of Brevard County. It's going to be a wonderful addition to all of our lives here. I have 4 children here growing up, and we know where we'll be coming to the hospital.
Okay,
if
that's
we need
great.
it.
All right, thank you very much.
We
Good luck to
appreciate
you.
it. Thank you.
All right. Okay.
Thank you.
All right.
Welcome back, folks. We are here today at the fantastic new facility, the Viera Hospital. I'm here with a gentleman who has been largely responsible for putting this whole amazing project together, Mr. Chris Kennedy. Chris, I know this is a momentous time for you and the team here. Just 31 days and counting, I think, right?
That's absolutely right. Culmination about total of about 5 years of planning and construction to get us to April 2nd.
Well, this is a very important work you've done here, and I know that it seems like you thought about everything that could possibly go into this hospital. Tom Palermo was telling me some of the features that he was just really amazed at the thought that went into it. Could you tell us about your vision for the hospital and how you've managed this whole process?
Well, I think that, we clearly understood that over a number of years that we have all been part of this medical community here in Brevard and have had the opportunity, whether it was down at the Holmes Hospital with that expansion or at the Cape Canaveral Hospital, that was really just a tremendous amount of groundwork that really laid the foundation for us to be able to take all the best that we knew worked real well, and then envision really what were the other things that created barriers for taking great care of patients. And so we spent some time taking a look at what we call best practices, or folks that had been very successful, that had just completed construction projects. I spent a lot of time asking a million questions about why you did this, why you did that. And then really we brought the leaders from across the organization who took care of patients and said, what were the things that, again, create barriers in delivering that? What things do we do real well? And really started to build this Rubik's Cube and build upon that. And we knew that as an organization that we'd spent the first 16 years really bringing components of the healthcare system together. But this was going to be the birth of really something unique and spectacular that was going to add great value to this part of the community. And so part of the inspiration was, again, that tree that's in the center of the circle, and just realizing that that oak tree had very, very deep roots, and that's what Health First has had. And so it's given us an opportunity, again, of planting kind of a seedling out here and take from that and really have something that would have a wonderful platform for delivering care, and a place that folks will find a very healing environment. It will attract and help us retain the best and the brightest in caring for patients, and have the opportunity for future growth as we move to the west.
Yes, that's so true. And as you drive up Wickham Road, I found myself really thinking deeply about that oak tree as you drive up to the roundabout, and it really sets the tone for this whole project. And I know that was a lot of good planning that went into that. Chris, could you tell us something about the features at the hospital that people might find interesting and unusual?
Sure. Well, first of all, we worked real hard to be a hardened structure, knowing that some of the things that we were faced with in the community when we do have hurricanes, and so there was a number of elements that create for a very, very strong facility. We wanted to make sure we brought a lot of natural light in. And also, as you come into the building, it was real important to us wayfinding. It was important that folks, because this is a considerable size facility, that it'd be very easy to get around the facility, and also have things that were in close proximity to the services you have. So as you come in, you'll see, though it's a long hallway, there's certain markers with columns or colors or lines that, again, just kind of drive you towards making it very easy to go ahead and get through the hospital. And then the things that are needed for the patients next to our emergency room, we placed those key services adjacent to those. And there's probably hundreds of little items like that, again, to create an environment that our clinicians and our caregivers, and what I say are folks that care for our caregivers, will be able to really excel and do an excellent job.
And I know that we have a vital watch system. Can you tell us something about that?
We do. All of our critical care beds are monitored across our system. So when after hours, through the night, we have a critical care unit in which we have intensivists that actually every patient is being watched, and it's a computer system that allows for algorithms in which there's change in patient status even before they actually show symptoms, that we see those variations, and then we're able to go ahead and intervene. And that results, again, in having the support that you need. The nurses, the traditional model is you would contact the doctor, he'd give you some instruction, and he'd work his way into the hospital. In real time, that physician is viewing and seeing that patient remotely. And so we're going to actually enhance that by being able to do that even remotely in our emergency room and other areas, and we'll also have key intensivists right inside the hospital during normal working hours.
Wonderful. Well, I know that the facility is absolutely state-of-the-art, and of course you'll be attracting the very best and brightest minds in the county to work here with Health First. I know that you've got the stars in the medical office building as well. Can you tell us something about those people and those services that will be added?
Sure. The medical office building, again, the campus, we refer to it as the health park. And so the first component of that was the pro health and fitness and our rehab. And we wanted, again, it's always been a vision of Mike's and Larry's from the beginning to make sure that we not only cared for folks that when they were sick, but we helped to try to keep a community healthy. And so we led off with that, and then the component we tied into next to the hospital was a medical office building, diagnostics, in which key subspecialties would be right on the site. So again, folks in this Viera Suntree community could have the services they need, be able to see their doctors. We have oncology, general surgery, family practice, really all the types of services right next to the hospital. So again, if they're requires an intervention or a consultation, again, those resources are right next door.
Wonderful. I know you're meeting an incredible need here, right in the middle of Brevard County. You'll be helping folks from north to south, and everything, folks, from the medical office building to this amazing state-of-the-art hospital. Chris, thank you so much for putting your life's work into this project. I know it's been a momentous project for you, but many congratulations, and thank you so much for your contribution.
Well, on behalf of about 6,000 associates, I'm just one guy that worked with a wonderful team to make this dream be realized. So on behalf of them, I appreciate and accept your congratulations.
Thank you very much.
You bet.